All right, let's now get into that discussion about matters health. And as I'd earlier mentioned, our guest this hour is Dr. Catherine Nyongesa, who is the CEO of a Texas Cancer Center. And I believe you are pretty much an expert in these issues. Thank you very much, Dr. for coming in. And we're just before we get into matters cancer, we're just taking a look at the health crisis we have in the country, the industrial actions that have been witnessed, and the negotiations that are going on between doctors, nurses, and the government. The nurses signed, but the doctors still staying put. Just your own opinion, what exactly do you think about this crisis?
I'm hopeful that the two parties will come to an agreement soon, as this is impacting quite negatively to our people. What I can say is that doctors are agitating for a better pay, because they work hard. They have spent so many years in school, and they want to get a better pay to offer better services. And they're also hoping that the government improves the public health care facilities so that the doctors are able to work in a better environment. So I'm hoping this should come to a conclusion soon.
Yeah, that's pretty much called for. But let's talk about the cancer patients. This strike has affected everyone, including cancer patients who are in public hospitals. How would you describe probably the kind of state that they would probably be in right now?
It's quite it's a problem, because patients go to hospital. You know, most cancer patients are in a lot of pain. Some of the cancers are bleeding. So when they get to hospital and the hospitals are closed, they really get distressed. And some of them actually are succumbing to the disease because of lack of attention. So they end up maybe streaming into other private healthcare facilities to seek help.
What happens to those who are not, who cannot afford the treatment at private hospitals? Just take us through what would happen to a cancer patient if they are not attended to, given the kind of constant attention they require.
Many things. I mean, one is if the patient is in pain, you know, they will be breathing in pain. But most of them, you know, cancer is not an acute illness. It is an illness most patients have had it for a few months. So with the strike having been a week, they usually try to look for alternative ways of getting their pain relief, their comfort. So they walk into chemists, for example, to buy off-the-counter pain medication. And some who can totally not afford, and it's an emergency. As you know, in Kenya, any emergency should be treated in any hospital, and they're actually free to seek treatment in any hospital for emergency care.
How would you describe the state of cancer in this country currently?
I would say the numbers are increasing. It's like an epidemic. Actually, it should be declared as one of the national disasters. For now, cancer is the third leading cause of death in the country, just after infectious diseases, cardiovascular. So you can imagine it's quite high on the list. Yeah. And in a year, the country diagnoses about 40,000 new cancer patients. And out of this, we lose 28,000. So the majority of the patients, it means they're coming late and succumbing to the disease.
Do we, as a country, have capacity to handle cancer cases?
Okay, the government has made a lot of efforts to this problem. And also the private sector have come in a big way also to support the government. At the end of the day, we want good care for our cancer patients, whether it's in private or in the government. We know that there are cancer screening equipments in all the counties. And at the moment, we have also doctors in training outside the country to come back and offer this important service. And as I speak, the University of Nairobi is actually rolling out training for oncologists So these are cancer specialists to take care of the patients. And having said that, we still have a lot to be done, especially by the government, to invest in those hospitals to have a better capacity to take care of these patients.
With the numbers going up and everyone trying, the private sector, the public sector, trying to contain this, there's the issue of awareness among Kenyans, sensitization, asking Kenyans to go for screening. Do you think the Kenyans are really aware of this particular disease and how they should go about it, even the preventive measures?
Okay, the awareness, I would say it's not to the capacity as a country, maybe we wish to be at this particular point, but there are efforts. We know there are patients, for example, Uwezo Cancer Support Group. These are cancer victors who come together and try to maybe give talks, for example, in churches, in schools, to just tell the people what are the early symptoms of cancer and where one can get help. We also have the media, which is doing a very wonderful job by enlightening the members of the public, like during Cancer Month and even a time like this, so that people are aware about cancer, that it's actually one of the biggest killers in our country, and people should be aware of the most common signs and symptoms of the common cancers.
There's a common misconception that once you're diagnosed with cancer, that's a death sentence. And I think this has affected thousands of people who have been diagnosed with cancer. What is being done to try and deal with that?
Yeah, okay, cancer diagnosis is not a death sentence. Something can be done about it, especially if one goes early for treatment. And the treatment options are many, depending on the type of the cancer and the stage. So the secret word is early diagnosis. And also, as members of the public, maybe if you notice anything unusual with your body, you need to seek medical advice. They check in case there could be symptoms of cancer.
Many Kenyans go to India for a treatment. It's a preferred destination for a cancer treatment. Does this mean that we are incapacitated as a country because we have thousands going to India, and that's usually the first option when one is diagnosed?
Okay, what I would say is 95% of the cancer cases can be managed locally. Only a few of the cases can maybe go overseas for specialized treatment. As a country, there are efforts which are being made both by the government and the private sector. And for example, operation can be done even in the county hospitals. So it's not that it's only in India. If one needs radiotherapy, there are radiotherapy centers in Nairobi, many of them including Texas Cancer Center, the Kenyatta National Hospital. If you need chemotherapy, at the moment, by the way, the National Hospital Insurance Fund is catering for all that treatment. It can pay for your chemotherapy, it can pay for your radiotherapy. Yeah.
At Texas Cancer
At
Center?
Texas Cancer Center and all the major hospitals.
Could you say that you provide the same standards of treatment at your facility as what Kenyans go to seek out in India?
As I told you, there are about 5% of the cases who may need more complicated, sophisticated treatment, and those ones, yes, they can be referred outside. But in Kenya, we have a capacity to manage most of the cancer cases.
What are some of the preventive measures that Kenyans can take or anyone can take against cancer?
Okay, I would say maybe a third of the cancer cases, the risks can be modified. For example, by exercising, eating healthy, avoiding a lot of fat in your diet, avoid smoking and alcohol. And I've seen even women get cancer because their men have been smoking. If your man smokes in the house, in the bedroom, know that all the children in that house and even the woman, they're all smokers. So those are some of the things that needs to be changed. And also, if there's a positive family history of cancer in your family, then one needs to go for screening so that they are checked to to make sure they are not prone to getting cancer.
Why don't most Kenyans go for screening? It looks like sort of a preventive measure because if you know your stage earlier, you could prevent this.
You know, cancer is just number 3 cause of death in our country. Number 2 is like high blood pressure, diabetes. But you know, people are aware, but you hardly see Kenyans. In fact, if you ask them, do they know if they are hypertensive or not, most of them do not even go for a simple blood pressure check. So it's more of increasing awareness. So, so that even to cancer, people should know that they can actually go to be checked so that it can be picked up early.
Cancer treatment and health, but the health sector has been devolved into the county governments, into the governments down at the grassroots level, so that some cases can be handled there with all the quality and standard that is required. How would you rate the performance of county governments in the health sector, especially when it comes to cancer treatment?
For now, our counties are not, I would say they are not fully ready for cancer patients. As I mentioned earlier, they have only put cancer screening equipment. But with devolved health, for example, there are things that can be done at the county. We actually formulating the national cancer guidelines. And with these national cancer guidelines, things like surgery, chemotherapy may be done at the county level, depending on the extent of the treatment. And then the more complicated cases then can be managed at the referral level. For now, we still have shortage of oncologists or cancer specialists in the counties. They are not there. All of them are in Nairobi and Eldoret. So you go to the other counties, there's no cancer specialist. But in terms of surgeons, they are there in all the counties. And maybe that is the only problem, that if we get more doctors who can do chemotherapy, then they can be put to the counties.
So there's need for improvement when it comes to facility and manpower.
True, because even all the cancer radiotherapy machines are in Nairobi. There's none in the county.
If all this is done and all the county governments have such facility, do you think it would lead to the reduction of the number of cases we get on cancer?
Okay, the cases may not reduce, but they may they could be caught early and even managed at the county level. Because we find most patients, present early to the county, but because of navigating to the central, like you have to come to Nairobi to Kenyatta Hospital or to Texas Cancer Center. So that takes a long time. One, maybe you don't have transport to come to Nairobi. Nairobi is not a friendly city, especially if you are from the village. You need a place to stay. You need some money to move around. So, and it doesn't mean that you'll arrive, for example, at Kenyatta today and you get treatment today for cancer. You know, there's a booking and there's back and forth. You have to do some couple of tests. So that makes patients, sometimes they get discouraged. They don't want to come to Nairobi. And sometimes they go back home and the cancer progresses and they're picked late. So with the devolution, probably these patients can be treated at the county level and the cancer may be managed at an early stage.
So what could we do as a country to reduce these numbers?
Okay, the big thing is really working on the Cancer Control Act, you know, whereby people go for early screening and creating more awareness so that we don't receive patients who have already been diagnosed with cancer in late stages. And if we have all those awareness, then people going for screening, it may reduce the numbers. Yeah.
Thank you so much, Dr. for coming into News Center. That is Dr. Catherine Nyongesa. She is the CEO of Texas Cancer Center. And of course, she's talking about the state of cancer in the country. And of course, we're also looking at the health crisis in the country and what this means for cancer patients. But let's get